We are going to explain what TILs, tumor infiltrating cells, are. TILs, tumor infiltrating cells, are the lymphocytes isolated from the inflammatory infiltrates and around surgical resection samples of solid tumors. They are usually composed of CD8 positive T cell, natural killer cell, CD4 positive T cell, B cell, plasma cell, but they are not contained in the same proportion. CD8 positive T cells and natural killer cells are the most common lymphocytes found in TILs. This is natural given that these two types of cells are cytotoxic cells and tumor cells have to be eliminated by their cytotoxicity. How CD8 positive T cells become tumor-specific cytotoxic T lymphocytes. For initiation of CD8 positive T cell responses, a cross-presentation with MHC class 1 and constimulator is needed. Most tumor cells are not derived from APCs, antigen-presenting cells, nor do the tumor cells express constimulatory molecules needed for naive T cell activation. So, to activate anti-tumor CD8 positive T cells, tumor antigens have to be presented by DCs, dendritic cells, the best APCs for transporting tumor antigens to secondary lymphoid organs and for activating naive T cells. At the site of a tumor, DCs can ingest tumor cells or their protein antigens and carry the tumor antigens to lymphoid organs through lymphatic vessel. In lymph nodes, the DCs display tumor peptides on MHC class 1 along with constimulatory molecules to naive CD8 positive T cells, and stimulated T cells differentiate to tumor-specific CD8 positive T cells. These tumor-specific CTL migrate to tumor sites and kills tumor cells. This tumor killing system associated with effector T cells is used for cancer treatments. There are two types of adopted T cell therapy, in both of which T cells are adopted from a cancer patient tumor tissue or blood. In adoptive cellular therapy with autologous tumor-specific T cells, the T cells from a patient can be cultured in vitro with anti-CD3, anti-CD28, IL-2, and especially with tumor antigens to increase the numbers and functional activity of cells specific for the tumor, and then transferring back the activated T cells into the patient. In chimeric antigen receptor T cell therapy, T cells removed from a cancer patient are induced tumor antigen specific CAR gene, then cultured with anti-CD3, anti-CD28, IL-2 CARs. Symmetric antigen receptors can recognize tumor antigens on tumor cell surface by themselves, so the effector T cells with CARs can kill tumor cells without MHC molecules presented. Although relatively few, B cells and plasma cells also play an important role. APCs present phagocyted tumor antigens, which derive from the surface of tumor cells on MHC class 2 to CD4 positive T cells and activate them. Then, activated CD4 positive T cells stimulate B cells and they differentiate to plasma cells. Plasma cells secrete the antibodies with affinity for the tumor antigens. The antibodies bind to tumor antigens on cancer cell surfaces and start antibody-mediated effector mechanisms. By initiating the mechanisms such as CDC, complement-dependent cellular cytotoxicity, ADCC, antibody-dependent cellular cytotoxicity, and ADCB, antibody-dependent cellular phagocytosis, the cancer cells are eliminated.